Gaza, but speak to Dr. Mimi Syedan, who's an emergency medicine physician working in the enclave. Doctor, thank you so much for your time. First, can you tell us where you've come from and where you are right now?
Hi, yes, I'm Dr. Mimi Syedan. I'm a board-certified emergency medicine physician from the U.S. I'm here on my second mission, actually. I'm here at Al-Aqsa Hospital in Deir al-Balah, here working in the emergency department. Previously, I was at Nasser Hospital in Khan Yunis.
What have you seen since you've returned?
I mean, it's just another level of destruction that I didn't imagine would be possible. When I was here in August, we had multiple shrapnel injuries, explosive gunshot wounds, many of them pediatric cases in women. And I didn't think that I would come back and it would get worse. Not only are the injuries and the casualties still here, but we're seeing the sequelae of this aggression just tenfold. We have malnutrition, hypothermia. I think today we had our fourth newborn that died of hypothermia in one of the tents. I mean, I'm standing here in 4 layers and I'm freezing. I can't imagine what this would do to a newborn inside the tent with no insulation. So we're seeing a severe malnutrition, things that are completely preventable, water contamination. There's no ability to filter the water. There's no chlorine. The contaminant of E. coli is so high that children are dying of dehydration and renal failure, and it's just all preventable and unnecessary.
Are you able to confirm that patients who come to Gaza's hospitals are dying when they could be saved, but dying because of a lack of supplies?
Absolutely. I mean, there is no doubt about it. You can ask any physician or healthcare worker that's coming in to Gaza. The level of destruction to the infrastructure of this population is unimaginable. And you can only realize it when you're here and on the ground. I can't even put into words. I've been asked by journalists, you know, what is lacking in Gaza? What do you need? And the answer is everything. Everything is destroyed. Everything is lacking. Water is a basic human need. Privacy, food, nutritious food. The food here is simple carbs. That's all that they can that they have. Babies, women that are lactating or pregnant women, that's not enough for them. Newborn babies are dying because their mothers can't breastfeed them because they don't have enough nutrition. I had a baby in a pediatric emergency department that was a 9-month-old that had severe diarrhea and just kept coming back to the hospital because every time they'd go back, they had contaminated water. So even if we do provide the intervention as physicians and healthcare workers, these patients are not going to get better unless something changes. And that's the very infrastructure, the repair that needs to happen.
Dr. Syedan, look, I appreciate you're not a military expert, but when you see some of the injuries that patients are coming to hospitals with, would you guess that possibly some of those injuries show that those people have been targeted while the Israeli troops know they're civilians? In other words, if you see a young child, if you see an elderly woman with a bullet wound, presumably those two at the extremes of the ages are not combatants and are not fighting.
Yeah, and then, as physicians and healthcare workers, our job is to collect data. That's what we do for a living. We collect data and we make conclusions based on that data. What I've seen so far from August to now, I've had multiple patients, children with gunshot wounds to the head and to the chest. I've spoken on other media outlets. I've had the CT scans and the x-rays to prove them. I've continued to see that. And I can tell you, just factually based, and you can ask any colleague of mine, about 70% of the patients that we are seeing are women and children. All of the patients that we've seen are civilians. I have not seen any military or anybody carrying munition. I've not experienced that in my last trip, nor have I experienced it now. So, I think anybody with any sensibility can make conclusions on that.
Just finally, you've been telling us a lot about communicable diseases, and we're expecting more people to expire from those diseases. How much more dangerous are diseases when people are malnourished and just don't have the sustenance that they need for their body to stay strong?
Absolutely. I mean, the recovery process requires a lot of the body, and that just starts with basic nutrition. We see so many post-op infections, and the surgeons can tell you that. Additionally, if someone did get interventions, the wounds are not healing. There's no protein that you can buy. There's no protein available for patients. So all of that is delayed. And then they go back to these conditions that are just horrendous and not compatible with life.
Dr. Mimi Syedan, your testimony is invaluable to the world that is watching. Thank you so much for taking the time to talk to us.
Thank you, Adnan. Thanks for having me.